This is the second half of the PowerPoint on bloodborne pathogens. We're going to start with standard precautions. Standard precautions is a lot of times also referred to as universal precautions. So if you hear that terminology used, it means the same thing, or it's used interchangeably a lot of times. Early iterations, first introduced in the 1980s, was due to the increase of HIV, HBV, or hepatitis B, or hepatitis C cases. Eventually, it just became known as standard precautions in 1996 by the CDC. The idea behind this is that all patients and all samples are considered infectious or contaminated. And the intent behind this is just to provide protections to patients and healthcare workers and to prevent the spread of healthcare associated infections or HIAs. And these standard precautions are made standard for all healthcare settings, whether you're in a doctor's office, whether you're in a hospital, where you're in a laboratory, it doesn't matter. They're standard across the board. Waste disposal, we talked about real briefly in part one of this presentation, but waste always goes into labeled biohazard containers in the laboratory setting. Waste and specimens with potential blood or body fluids, you want to put in those biohazard containers because you won't want that potentially to contaminate another worker or a patient. Each facility may have slightly different rules on waste disposal. Some facilities may want certain things to go in the biohazard versus not going in the biohazard because they have to dispose of their biohazard based on weight, and it costs per weight to dispose of the biohazard waste. So when you get to whatever facility that you're going to work at or do your clinicals at, you'll want to make sure that you know their protocol. And again, we mentioned this earlier, but sharps containers are used for needles, any finger stick devices like our lancets, or any other materials that might be sharp. We use some little wooden sticks to stir with, or wooden stick applicators, any of those things like that that could potentially punch through a bag or cause any kind of puncture in the skin. We want to put anything like that into a sharps container because we don't want it poking through the skin, or if it's poking through the bag, it could potentially poke through and contaminate somebody or cause an exposure. What we need to talk about next is practice controls. We talked about in part one about engineering controls, and those are things that we put into place, like physical things that we put into place to help protect us. But work practice controls are things that we do to help prevent the spread of disease, or habits that we implement. So these are like things like, how do we dispose of our waste? How do we clean up spills? The proper use of sharps containers. The type of sharps containers that we use, they need to be hard-sided so nothing pokes through. The vaccination requirements that we have in the healthcare field. You know, healthcare workers need to have certain vaccinations so that when they are exposed, they have some immunity. We require hand washing so we don't expose patients to things when we go into their rooms. We also require PPE to protect ourselves when we're working with samples and with patients. And we also just need to follow general lab rules and guidelines. The next thing we need to talk about and spend a little time on is just what is proper hand washing. We need to wet both hands with warm water, and they need to be rinsed and add soap. You want to lather your hands together really well, and you want to do the front and the back of the hands. You want to wash your hands for at least 20 seconds. And it said that if you sing the happy birthday song twice, that's at least 20 seconds. You want to rinse your hands from the wrist down. That's washing away, hopefully washing away any bacteria or contaminants that you have on your hands. You want to use a paper towel to turn off the faucet because the faucet itself could have contaminants on it. So if you just got done spending 20 seconds washing your hands and then you touch a dirty faucet, guess what? Your hands are dirty again. So make sure that you use a paper towel to turn off the faucet. You also may want to make sure to dry your hands really well, especially if you're getting ready to put on a pair of gloves next, because you'll find it really difficult if you haven't already to put on a pair of gloves with wet hands. Okay, the next thing we're going to talk about is the exposure response. What are you going to do if you do happen to have exposure? Let's say something splashes into your eye. So we need to wash your eyes out. Let's say something happens in the classroom and you're doing a lab, something splashes into your eye. So there is an eye wash station in the classroom. So you're going to locate the eye wash station in the classroom, and you're going to need to flush your eyes for 15 minutes. Of course, you're going to notify the supervisor, and the supervisor in the classroom setting would of course be your instructor, and we're going to file an incident report. Next would be needle sticks. We are going to be working with needles in the classroom, and you'll be working with needles in the clinical setting. So this is a possibility, even if you're careful. Sometimes it happens. If it does, you're going to wash the area with soapy water, and you're going to notify the supervisor or the instructor. If you're in the clinical setting or the classroom, you're going to report to the ER, and you're going to follow the treatment plan, and there's going to be an incident report filed, including a follow-up and a treatment plan. Also, anytime there's any kind of exposure, there's going to be documentation of the exposure. You'll complete documentation in the policy manual, and we're going to file that in the business office for insurance purposes. And you'll see our medical laboratory technology policy in our manual. Okay, I hope you enjoyed your very first lecture on bloodborne pathogens and have learned a lot. I look forward to seeing you in class this week for labs. If you have any questions or concerns, you can email me. See ya.